Hello everyone. Today our topic is adult orthodontics, which is a very important question in final year. I have prepared this answer from SI Bhalaji if anybody would like to refer to it. So let's begin without wasting a moment. Starting with the definition, it is given by Eckermann. According to him, adult orthodontics is concerned with striking a balance between achieving optimal proximal and occlusal contact of the teeth, acceptable dentofacial aesthetics, normal function, and reasonable stability. I have colored various parts of this definition to help you in easily memorizing it. Just remember the four most important points of this definition are occlusal contact, aesthetics, function, and stability. There are various reasons for increase in adult patients nowadays, like innovations in appliances, especially the advent of direct bonding, ceramic brackets, and tooth color buyers. The latest development is lingual orthodontics, or you can say invisible orthodontics, and also Invisalign have made the orthodontic appliance less conspicuous. Increased experience with adult orthodontic treatment and the achievement of good results. Increased public awareness of the possibilities of orthodontic treatment and management of skeletal jaw dysplasias with the help of orthodontic surgery. There are various factors which have increased demand for adult orthodontics today, like media, insurance, affluence, family dentist awareness, and aesthetics. Coming to the difference between adult and adolescent patients, the basic difference is that there is no growth potential in adults. Only tooth movement can be expected. However, in children, there is possibility of tooth movement along with growth modification. Appearance of appliance is often a great concern for adults. Usually, it is not of any concern in children. Adults take more time to adjust. Appliances must be well made and carefully adjusted. Children, however, tolerate most appliances readily. Speech. Adults find it more difficult to adjust, whereas children will adjust quickly. Periodontal disease may be a complicating factor and must be eliminated before starting orthodontic treatment. However, in children, usually there is no periodontal disease, and if present, it is not severe. General health must be considered in adults more carefully prior to treatment. However, in children, it is usually not a concern. Patients are usually well motivated, and cooperation is not a problem for adults. In children, the cooperation may range from poor to excellent. Adult patients are usually very appreciative of the treatment. However, children are not that appreciative. Mnemonic to remember the points or factors for differentiating is different appearances affect speech, periodontal disease, general health, cooperation, and treatment appreciation. Coming to the indications for adult orthodontic treatment, which were given by Ravens, to improve tooth periodontal tissue relationship, to satisfy the aesthetic desires of the patient, to improve spaces to provide normal tooth to tooth contact, improve occlusion and coordination with the masticatory muscles and the TMJ, to establish an improved plane of occlusion in order to distribute forces through the broadest area possible. And the last one is to balance the existing space between teeth for better prosthetic replacement. The acronym to remember the indications is the word reactor, which is made using the first letter of the last words of each indication. Now coming to the contraindications for adult orthodontics, they were given by Barrer. Severe skeletal discrepancies, advanced local or systemic disease, excessive alveolar bone loss, inability to obtain a result that the doctor or patient will perceive as satisfactory, poor stability prognosis, and lack of patient motivation are all the contraindications. It can be remembered using the mnemonic strong dogs bark, smiling proudly and merrily. Coming to the biomechanical considerations, in cases of attachment loss, there will be loss of crestal bone, which will result in reduced periodontal ligament area. So, same amount of force will produce more pressure per unit area. Also, the center of resistance will shift apically, hence, the moment of force will be increased. Age-related changes seen in the periodontal ligament, as given by Norton, there will be reduced blood flow and vascularity as the age increases, hence reduced progenitor cells, due to which there will be reduced osteoblasts or osteoclasts, hence there will be slow tooth movement. Age-related changes in the bone, there will be more cortical bone and less cancellous bone, which will again reduce the rate of movement. And local changes comprise of disuse, atrophy of bone, and soft tissue changes. To the guidelines for force application, the forces used in adults should be at a lower level than those used in children. The initial forces should further be kept low because the immediate pool of cells available for bone resorption, that is, the progenitor cells, are low. The moment to force ratio for a particular tooth movement should be increased according to the periodontal status of the individual tooth. With increasing marginal bone loss, light continuous forces should be maintained during tooth displacement. Now coming to the diagnosis in adult orthodontics, the standard protocol of case history, clinical examination, study casts, radiographs, and photographs should be followed. Additional diagnostic procedures include TMJ series of X-rays, muscle examination, stress evaluation, diet evaluation, and periodontal considerations like post-treatment periodontal care and long-term need for retention. Multidisciplinary approach comprises of the general dentist, orthodontist, restorative dentist, prosthodontist, oral and maxillofacial surgeon, and plastic surgeon. Talking about the treatment aspects in adult orthodontics, there are three kinds of treatment: comprehensive orthodontic treatment, adjunctive orthodontic treatment, and surgical orthodontic treatment. Adjunctive orthodontic treatment comprises of the tooth movement carried out to facilitate other dental procedures which are necessary to control disease and restore function. Typically, appliances are required in only a portion of the dental arch and for a short time. Procedures include uprighting of teeth, forced eruption, and alignment of teeth. Comprehensive treatment for adults include that orthodontic treatment which would take more than 6 months duration. It is similar to that in adolescents where special considerations are given to biological limitations, lower force levels, periodontal considerations, multidisciplinary approach, aesthetic requirements, comfort requirements, and biomechanical considerations. Adults are turned off by these five things: anesthetic appliances, fear of pain, extended treatment time, personal inconvenience, and cost of the treatment. The appliances used in adult orthodontics should fulfill the following requirements. Simple. They should be simple in order to maximize cooperation. They should respond to light force for best physiological response. They should be fixed to maintain treatment control. They should be long acting. to decrease the number of appointments. They should require the shortest overall treatment period while affording us the highest potential for a stable correction with minimum retention requirements. Surgical orthodontic treatment, which comprises of the orthodontic surgery, which can be performed in the maxilla as well as the mandible to correct jaw discrepancies in all the three planes of space. It requires a team approach with the oral surgeon and the orthodontist being important members of the team. Is the retention. General principles of retention hold good for adult patients. Retention is a critical and challenging aspect of adult orthodontics. Post-orthodontic stabilization, restoration of mutilated dentition, and cross-arch stabilization is the need of adult orthodontics. If you like this video, please subscribe to my channel. Thank you for watching. Let me know in the comments below if you want me to take any videos of specific topics. Any kind of feedback is welcome, whether positive or negative. See you in further videos.